You've talked about insulin resistance there a couple times, and a piece of it I think that's important for us to talk about is the fact that insulin resistance can be affecting us in the background for a period of time before we see it in the blood glucose. A lot of doctors are going to test fasting blood glucose in the morning and see where that's at, but even if that is in a normal range, that person could be building up insulin resistance over the years, which that increased insulin is going to keep the blood glucose down. But as we've talked about, insulin is one of the enemies and blood glucose, which have this intimate relationship, but they need to be looked at separately.
Yeah. So one takeaway I would say to everyone listening to this is go ask your doctor for a fasting insulin test. And this is for the exact reason that you just mentioned, Jesse, which is that insulin problems and insulin resistance can show up well over a decade before our standard lab tests like fasting glucose will start to have problems. And this is because of what we talked about. The body has this incredible adaptive capability of essentially overcompensating for a problem for a long time before the system really breaks and we really go off the rails. But in that intermediate period where insulin resistance is going up, insulin levels are going up, but glucose is still staying the same in the bloodstream because the body's essentially overcompensating to overwhelm the insulin resistance and still get the glucose taken up out of the bloodstream. That period we are missing in Americans right now. And that's a big problem because we're missing the pre-disease state, the pre-overt disease state where there's already cellular dysfunction that is having a hugely negative impact on our health. So one thing that you can do to look into this is to get a fasting insulin test and see if it's starting to go up. We want it to really be between about 2 and 6 on our lab slip. The standard ranges will say anything under 25 is normal, which if your fasting insulin is 25, that's a big problem. That's hyperinsulinemia. So really shooting for an optimal range around 2 to 6 is really optimal. And then you can also, if you get a fasting glucose test at the exact same time as your fasting insulin test in the same blood draw, you can just go online and there's actually a calculator for insulin sensitivity called HOMA-IR. And you can plug in your glucose and insulin and it basically uses a mathematical equation to give you a readout of insulin sensitivity. And there's other things that you can do. Let's say your doctor won't order a fasting insulin test for you because it's not standard of care. We don't do this normally, which is very, very strange. What you can do is just look at your standard cholesterol panel. And on the standard cholesterol panel, you're going to see four different types of cholesterol. So you're going to see total cholesterol, HDL cholesterol, LDL cholesterol, and triglycerides. And interestingly, you can take a ratio of two of those numbers, triglycerides, and divide it by HDL. So do a triglyceride to HDL ratio, and that can actually give you a clue about your insulin sensitivity. And so that's kind of just like a little simple way that you can get a sense of it. And what we really want to see is that for people, there's not a consensus of exactly what this number should be for optimal health because we don't really think that much about insulin sensitivity, unfortunately, in our current healthcare system. But if you look at kind of what experts say, it actually seems like it may be in part ethnicity dependent, and that for people who are Caucasians, you want to be below about 2.5 to 1 on the ratio, and for people of African American descent, a little bit of a tighter ratio of 1.5 to 1. So let's say your triglycerides are 100 and your HDL is 50, that would be a ratio of 1.5 to 1. I think if I did the math right. And so I'm really actually shooting for 1. So that would be like a triglyceride of 70 and an HDL of 70. And triglycerides are the part of the cholesterol panel that really tells us about how glucose and carbohydrates are being converted to fat in the bloodstream. And so you're looking at essentially a ratio of the amount of cholesterol in the bloodstream that's sort of related to excess carbohydrates over HDL, which is our good cholesterol that brings it's the type of cholesterol that goes back to the liver and clears cholesterol from the bloodstream. So that's kind of what you're looking at. So Fasting insulin is a great test, and triglyceride HDL is something that all of us can look at if we have a standard cholesterol panel. So insulin sensitivity is something we should all know about in our own bodies. And unfortunately, it's something we have to advocate for on our own because it's not standard of care to test these things.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
If you are an American born today, you are on a direct trajectory towards having a blood sugar problem, having metabolic dysfunction, and having insulin resistance. And this will increase.